Hello, my name is Yorlin Hernandez, and I'm a sports medicine 3 student, and I will be presenting Osseointegration prosthetic project. So what I will be talking about is the anatomy, reason for the surgery, kinds of prosthetics, what the surgery includes, video of the surgery, and the rehab process. So first we'll be talking about the anatomy. There are different kinds of osseointegration processes. So I'm specifically looking at the femur just because it is a bigger area, and so the process of the implant will be clearer to see. So reason for osseointegration. Osseointegration, unlike traditional implants that rely on mechanical fixtures or adhesives, osseointegrated implants fuse directly with the bone, providing superior stability. The firm attachment minimizes the risk of implant loosening over time, which is a common issue with conventional implants. Osseointegrated implants mimic natural bone loading, distributing forces through the bone more effectively and reducing stress shielding. Osseointegrated implants typically last longer than traditional implants because they integrate with the bone, reducing wear and tear or failure caused by micromovements. These implants generally require less frequent adjustments or replacements. The direct bone-to-implant connection reduces gaps where bacteria can accumulate, lowering the risk of infection compared to implants that rely on different kind of processes. The stability and integration with the bone results in a more natural feel and function, particularly in limb prosthetics. For limb prosthetics, osseointegrated devices eliminate issues like skin irritation and pressure sores caused by traditional socket-based systems. Osseointegrated prostheses provide direct skeletal attachment, offering improved mobility, range of motion, and control compared to traditional socket systems, as well as natural healing processes. So, materials like titanium are highly biocompatible, encouraging bone growth and minimizing rejection risks. There is also a better quality of life. Patients often experience improved movement and usability, whether it's chewing, walking, or other daily activities. So next we'll be looking at the two different kinds of implants for osseointegration. So the first one is the OBRA, also known as screw shape, and ILP, also known as press fit. So the OBRA is a two-stage surgery. The first stage is the insertion of the screw shape implant into the femur and then allowing the bone to heal and integrate. The second stage is the connection of the external prosthetic component after osseointegration is complete. Some advantages of this surgery is that there's a reduce in micromovements due to the threaded design, which ensures firm initial fixation. There's also bone integration, which is the titanium, and long-term durability. Screw design minimizes risks of implant loosening over time. However, there are some disadvantages like longer recovery because of the two surgeries, as well as the high skill requirement. Next, we'll be talking about the ILP system. Unlike the OPRA, it is a single-stage surgery which allows for quicker recovery. Some other advantages is the bone remodeling. So basically, the press fit design encourages natural bone remodeling around the implant. The ILP also has a faster load bearing, which means that patients can usually begin using the prosthetic limb earlier compared to the OPRA. Some disadvantages is the potential micromovements as well as the risk of loosening. So what the OPRA surgery includes. The OPRA surgery involves a two-stage surgery to implant the device into the limb, which is the femur. This method allows the bone to heal and integrate with the implant before attaching the external prosthesis. What the surgeon does is prepare the incision and then drills the bone and removes the insides of the femur, and then the size and depth are carefully calculated based on imaging like CT scans and x-rays, and then the surgeon places the implant into the femoral canal and then closes the suture, and the patient is then typically waiting 3 to 6 months for the bone to heal before beginning stage 2. So stage 2 is where the surgeon goes in, opens this incision again, and the surgeon attaches the titanium rod to the internal fixture, and then the surgeon grabs the soft tissue and carefully reshapes around the titanium rod to minimize irritation and reduce the risk of infection, and then closes the surgical site again, and then begins postoperative recovery. So now we'll be looking at this video of the surgery, but for this surgery, however, there was no surgery for the femur, so this one is the tibia, and this is also not the OPRA, it is the ILP.
Is placed centrally in the bone. The canal is prepared first with a drill and then with broaches. The implant is optimally sized so that there is immediate stability and fit. The implant is porous coated and is impacted into position. Immediate stability is achieved. A dual cone connector is applied. And this is followed by...
So after the surgery, we are now entering the post-surgery or the rehab phase. So here the goals is to allow the bone to begin integrating with the implant, manage pain, swelling, and inflammation, as well as protect the surgical site and the stoma. For the focus, we are looking at non-weight-bearing activities, so using crutches or a wheelchair, as well as gentle range of motion exercises for the adjacent joints, like the hips for this case, and as well as some isometric exercises, which would be quad sets, which is in the videos here, and glute squeezes. So next we'll be talking about stage 2. The goals for this is to begin gradual loading to stimulate bone growth and implant integration, improve strength and range of motion, as well as maintain proper posture and alignment. So for the focus for this is to progress from partial to full weight bearing, as well as muscle strengthening, including exercises like straight leg raises, bridges, and resistance band works. Core stability exercises to support functional movements, and balance and proprioception exercises. An example of this would be standing with support. So next we're going to be looking at phase 3, and the goals for phase 3 is to develop functional strength and endurance, as well as improve gait mechanics and balance, and lastly enhance confidence using the prosthesis for daily activities. So here the focus is full weight bearing with prosthesis, strengthening exercises like step-ups, as we can see, leg presses, or light squats. Some dynamic balance training, which would be standing on an uneven surface or using a balance board, and then gait training, which is focusing on weight distribution and symmetry. Lastly, strengthening and functional training, which is phase 4. The goal for this is to maximize strength, endurance, and range of motion, begin high impact or sport specific activities if it's appropriate, and improve prosthetic control and confidence. So here we're going to focus more on functional tasks like climbing stairs, walking on uneven terrain, or carrying heavier loads. And if the patient is further along, this can also include high impact activities if clear, like running, jumping, and continuing care of their stoma and monitoring the implants. But after that, they are ready to go, and the focus is just to heal. So that is it for my presentation. Thank you for watching.